Welcome to Ulosca channel. Access all nursing practice questions. HESI Fundamentals practice questions with answers.
Question 1. Which of the following is a priority action for a nurse caring for a patient who is post-surgical and has a Foley catheter? A. Assess the patient's pain level. B. Monitor the urine output. C. Change the catheter bag. D. Administer the prescribed antibiotics. Which one is the correct answer? The correct answer is B. Monitor the urine output. Explanation. The nurse should monitor urine output to assess kidney function and detect complications. Question 2. What is the primary purpose of performing hand hygiene? A. To prevent the spread of infection. B. To reduce the need for gloves. C. To keep the hands soft and clean. D. To prevent contamination of food. Which one is the correct answer? The correct answer is A. To prevent the spread of infection. Explanation. Hand hygiene prevents the spread of infections in healthcare settings. Question 3. Which of the following is an example of an objective data in a nursing assessment? A. Patient's report of pain. B. Vital signs. C. Patient's complaint of nausea. D. Feelings of fatigue. Which one is the correct answer? The correct answer is B. Vital signs. Explanation. Objective data refers to measurable findings, such as vital signs. Question 4. Which action should the nurse take when administering oral medication to a patient? A. Check the patient's identification band. B. Ask the patient if they are allergic to the medication. C. Allow the patient to drink immediately after taking the medication. D. Crush the medication if the patient has difficulty swallowing. Which one is the correct answer? The correct answer is A. Check the patient's identification band. Explanation. The nurse must check the patient's identification to ensure the right medication is given. Question 5. What is the most common complication following surgery? A. Infection. B. Hypotension. C. Nausea and vomiting. D. Deep vein thrombosis. Which one is the correct answer? The correct answer is A. Infection. Explanation. Infection is the most common complication after surgery. Question 6. Which of the following is an example of nonverbal communication? A. Writing a note. B. Giving a verbal order. C. Using body language. D. Asking questions. Which one is the correct answer? The correct answer is C. Using body language. Explanation. Nonverbal communication includes body language and gestures. Question 7. What is the first step in the nursing process? A. Assessment. B. Diagnosis. C. Planning. D. Implementation. Which one is the correct answer? The correct answer is A. Assessment. Explanation. The first step in nursing is assessment to gather information about the patient. Question 8. When preparing a sterile field, which action would break the sterile technique? A. Touching sterile items with sterile gloves. B. Opening sterile packages away from the body. C. Reaching over the sterile field. D. Keeping the sterile field above waist level. Which one is the correct answer? The correct answer is C. Reaching over the sterile field. Explanation. Reaching over the sterile field contaminates it and breaks sterile technique. Question 9. A nurse is performing a physical assessment on a patient with pneumonia. Which finding is most likely? A. Clear lung sounds. B. Tachypnea. C. Bradycardia. D. Low blood pressure. Which one is the correct answer? The correct answer is B. Tachypnea. Explanation: tachypnea is common in pneumonia due to difficulty breathing. Question 10. Which of the following should be the nurse's priority action when a patient experiences a sudden drop in blood pressure? A. Administer fluids as ordered. B. Position the patient in a supine position. C. Check the patient's pulse. D. Monitor for signs of shock. Which one is the correct answer? The correct answer is B. Position the patient in a supine position. Explanation: positioning the patient in a supine position helps increase blood flow to vital organs.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.